a health or fitness app on their phone? More. Who uses that health or fitness app? More hands? Good.
I do not have a wearable, unless you count my shirt that I'm wearing right now.
Yes, I do.
I don't actually. I've been looking into getting a Fitbit though.
I probably have one at home somewhere.
I do, but I don't use it anymore.
Got it as a Christmas present from my fiance's mother. She gave us each one to try to say, hey, make some proactive choices in your life.
I wear the Up 3.
What is this called? Do you remember what it's called?
I have a Fitbit, the first Fitbit, the Fitbit 1.
And it has heart rate as well as motion.
I don't have a wearable because that's a good question. I like the idea of them.
I've definitely thought about it, but it's just not something I've done yet.
Having issues syncing it to my app, so I haven't actually been wearing it for a while.
I used to use one. I just didn't feel it was necessary. Now it's going on the record that I don't use my Fitbit. After a while, I saw the same pattern, and I'm not sure why I was wearing something to tell me what I knew.
I know when I'm going up a hill, my heart rate's going to go up. At the end of the day, when I analyze it, I'm like, okay, I knew that already, I knew that already.
Well, I used to be more serious about athletics, and now that I'm not, the numbers don't look as good as they used to, so I don't like seeing them.
The Fitbit told me that I was not healthy, so I made more serious changes.
Healthcare, as our panel will attest, is a place where there's a lot of opportunity helping people make smart decisions and healthy decisions.
I don't know how to get the most out of my plan. I don't know how to use my plan. It's all very confusing, right? And there's so much complexity to the healthcare system. We were saying, okay, if we've got all of this data, we've got all this information, why don't we, instead of having the customer go find that information, we take it all and then we can proactively serve up what the customer should be doing next in order to get the most out of their plan. You don't always need to go to the emergency room. And on top of that, when you actually need the care, you're not necessarily thinking, well, let me go find one that's in network, low cost, high quality. So if we can have people figure that stuff out ahead of time, that they'll go where they should be going.
You know, I think one of the things we know, healthcare is a very personal relationship, trust-based relationship. And people trust their doctors and their healthcare team. They really don't have high trust for health insurance companies. Patient-provider relationship is really at the heart of healthcare, healing. That trust is just critical. Technology is a wonderful tool, but I still think we can't let technology can't replace that relationship.
One of the real difficulties with tackling something like weight loss, you're fighting against both the abundance we have in our society and the self-control necessary to overcome all that abundance. Changing behavior is extremely difficult when the context doesn't change.
I think mass customization and behavior change is very, very difficult. At Jawbone, we saw very predictive behaviors over time.
Within healthcare, are people logical and predictable, Galen?
No.
Yeah. No?
I'm
Okay.
going with Yeah. No, I don't think so.
Think of the user. You can overcomplicate things, but make it so simple that they'll want to use it. Philosophies I always had about things with the running shoes. You better make that shoe work when I put it on, because I'm there to worry about my running. I don't want to get a mile out and worry about my shoes, because that's the only piece of equipment I have. In theory, you could run naked, but I know my shorts are going to work and my shirts are going to work. That's my one contact with the ground. That's my one piece of equipment I want to run. I want to forget about that I even have them on. So remove the distractions, make it simple.
So you're hearing definitely a less is more theme here. Information is power. That tendency comes up loud and clear in the interaction design and technology development space. There is some variability in terms of accuracy.
And then there was the thing of a patient would eat a banana one day and be told it's 15 grams of carb, and she'd eat the same banana 3 days later and be told it was 25. And so there's the human side of things that they didn't have the consistency
Human
behind
error.
it. That's one of the biggest things. It's how we lose credibility. You know, I'm trusting you as a professional to tell me something, and you can't even agree as yourself. So then that undermined trust in the product.
Food was the hardest thing at Jawbone to solve. There was reported health differences between observed health and reported health. So people would report one thing, sizing portions, it was a nightmare. What they were putting in the app was, because there was a social aspect, it was just way off. Same with the fitness side of it. How hard was that workout for you? Oh man, that was a difficult workout. That was extreme. Oh yeah, and then the app says, you burned all these calories and then you can eat all this food. So that reported versus observed behavior as us looking at the data was significantly different, and food is almost impossible.
On that, it's interesting because we talk about social as a motivator and that being a big component of it, but it can have the opposite effect where maybe you're over-reporting. You're making it sound like I'm going above and beyond, I'm doing phenomenal, but in reality, like if the goal is just to get healthy, and accuracy is so important. So the social component's interesting because it kind of can swing it both ways.
When you're dealing with competitive, the Supercross biometrics that we did, you'll be able to tell that I drank a lot last night because my resting heart rate is so high, and so then the coaches would also get that data as well, and the coaches would come down on the riders. So I'm a team owner, I'm paying you, and I can tell that you're not doing the right things. And your performance may or may not suffer, but you can't lie to me anymore. It's observed behavior.
There's a fine line into the liability side of it, what you get with the data.
I think that data needs to be relatable, and I think it needs to be used for the right person in the right context.
Again, thank you guys for coming. Really appreciate it. Hopefully we'll see you next time. We're going to keep doing these connected thinking panels. Thanks.